I am Dr. Jothibasu. Good afternoon and good evening and all the students. I am Dr. Jothibasu, Senior Resident of Department of Radiology. I am working here for the past 10 to 15 years. I like to introduce myself about that. I am interested in the ultrasound basis. First, the students will know about what you mean by ultrasound. So, ultrasound, what is mean by ultrasound? Ultrasound is nothing but what is ultrasound? Ultrasound is nothing but ultrasound is nothing but defined as a sound waves above 20,000 hertz. Sound waves of the more than frequency of above the audible human range. That is, the audible human range will be the 20 to 20,000 hertz. Therefore, which cannot be heard by the humans. All the sound waves, including ultrasounds, are longitudinal waves. You know, it's longitudinal waves and horizontal waves. So, medical ultrasounds are usually in the order of megahertz. It will be more range to 1 to 15 megahertz. Ultrasound, as all sound waves, are caused by vibrations. What do you mean by how it is vibrated? Therefore, it causes no ionization and it is safely used in a pregnant woman. Ultrasound is also able to distinguish between the muscle and the blood and therefore show blood movements. So, what is meant by longitudinal waves? Longitudinal waves is nothing but compression and refraction, rarefaction. Part of that is called echoes. That longitudinal waves produce an echoes. Likewise, in the ultrasound meets a boundary between two different materials. Some of it will be refracted and some is reflected. The reflected wave is detected by ultrasound scanners and forms as an image. So the natural forms of the ultrasound and the sonar waves are, first one we will discuss about the natural bands. So bands will be moved by the ultrasound waves. So ultrasound waves will be produced by the bands and it is reflected and refracted by the obstacles and it is received by the bands and then it moves along. Likewise in the mammalians like shark and dolphins, it also produces the same ultrasonic waves in the water and it produces a reflection and refraction and compression of the waves and produces a obstacle and identifies and produces ultrasonic waves and finds the obstacles and it can move along them. The same principle used in the sonar submersible ships. So that is called sonar waves. That sonar waves can be used in the submersible ships. That is also the same thing when the ultrasound waves are artificially produced. It hits any obstacles in the undersea and then it will receive as a there is an obstacle. So we have to go by another way. So how the ultrasound works by the medical ultrasound works. Medical ultrasound is works by the pressure electricity that is called piezoelectrical effect. So this piezoelectrical effects is nothing but medical ultrasound are produced by the piezoelectrical effect when a potential difference is applied across a certain crystals. What is the crystal? That is called piezoelectrical crystals. These crystals is lead zinconia titanium. That is called PZT. These crystals themselves deform by contracting and little retracting. This is when the oxygen potential given into the piezoelectrical crystal, it will compress and rarefact. During compression and rarefaction, some will produce vibrates that piezoelectrical crystals at the same frequency and send out of the ultrasonic. Where for the ultrasonic waves, piezoelectrical crystals are used. This is process also works in reverse. The piezoelectrical crystals acts as a receiver of ultrasound by converting sound waves to the alternating voltage and as a transmitters by converting alternate voltage to the sound waves. Who discovered the ultrasound? Normally, ultrasound waves discovered previous to the X-rays, but it is emerged into the medical field only after the emerging of the X-rays. So, ultrasound waves discovered by the Parry and Jacques in the 1880s. So, this is the piezoelectrical effect causes the crystal materials like quartz to generate an electrical charges when the crystal material is compressed and twisted and pulled. The reverse also true. So the compressed crystal material compress and expands when the electrical voltage is applied. So coming to the next thing, what do you mean by transducer? The transducer is the main part of the ultrasound machines. The transducer probe transmits and receives the ultrasounds. The curved face place of the shapes the ultrasound waves into a narrow beam. So first you see the probe. Outer metal casing will be there, and then in the metal casing there will be a power cable will be there, and then acoustic insulator within the metal casing. There is a plastic nose will be seen, which is the main component is contact to the patient or any objects. So these piezoelectrical crystal is just above the plastic nose. These piezoelectrical crystals will be as a electrodes applied by alternating potentials. Transducer probes come in many shapes and size. The shape of the probe determines the it's a field of view and the frequency of emitted sound waves, controlled by the tuning device, determining how deep the sound waves penetrate and the resolution of the image. So the transducer probe has a many shapes and sizes. Normally, it will have curvilinear, linear, and transverse or sectoral probe. The shape of the probe determines the field of view or uh, field of interest. And the frequency of emitted sound waves will be that is by the controlled by the tuning devices. So determines how depth the sound waves can be penetrated and the resolution of the images. Some frequency is normally inversely proportional to the amplitude. If you want to see the superficial structures, you have to do it by the high frequency. If you want to the deeper structures, you have to do it by the lower frequency. So that ultrasound is a pulsed wave. That is a sound wave with pulsed wave. There must be a pass to allow the reflected waves to be detected. So there will be a gap in between them. That is a normal time gap will be there. Normally, sound waves will be travels in the speed of 330 meter per second. But the light waves will be travel in the speed of 3 into 10 power of 8 meters per second. So coming to the how the ultrasound images are constructed. The ultrasound images are constructed by the machine called ultrasound machine. So normally the ultrasound machine has a probes. So these probes will produce a when it is stimulated by the electrical energy. So this electrical energy action potential is given to the probe. That action potential, the piezoelectrical crystals within the probe will be compressed and rarified and produce waves. So electrical energy is converted into the sound waves. These sound waves will be travels and then hits the uh, targeted material. That most commonly what we are using is reflected by the tissues and other substances. So second waves, the sound waves, that sound waves are reflected by the tissues. And then the third one will be the reflected sound waves are converted into the electrical signals and later into the image. So this the piezoelectrical effect is vice versa. So first it will produce electrical energy is sound energy. From the reflected and refracted by the tissues, these produce an action potential in the piezoelectrical crystal and also produce electrical signals and later it is converted into image. So this is the ultrasound images construct. So this is the equipments. Normally the ultrasound equipments will be a screen and display and a transducer pulse control and the computer and the various transducers. Normally there will be 3 to 4 ports will be there in the for the transducer port. And it can be portable from the one place to another. So why ultrasound? What are the advantages of ultrasound and the disadvantages of ultrasound? No new hazards or non-ionization for the patients and the sonographers because it is a non-ionization radiations. So it will produce hazardous to the patients as well as for the sonographers. Good for imaging for only soft tissue, not only but also vessels and blood vessels. Not for ideal for the bones. And then relatively cheap and portable. It costs minimum minimum that is 1,000 rupees within 1,000 or 1,500 rupees. So it is a relatively cheap and portable. The disadvantages is mainly cannot pass through the bones because calcium it is not an ionization medium, though penetration will be very less in case of bones. And then cannot pass through the air spaces because air has a different velocity, and this solid or normally the fluid will be transmitting ultrasound, and then the solid organs will transmit the ultrasound. But gas spaces will not transmit it. It produces a dirty shell. That's why it is not passed through the gas spaces. And then poor resolutions. Because of the poor resolutions, the ultrasound is very difficult. So those who are trained in the ultrasound unit, they can be able to identify properly. So what is a gel? What we call impedance matching and gel. When ultrasound passes through the two very different materials, the majority of it is reflected. So first you have to see that when the ultrasound passes in the two different materials, this is one material and this is one material. In between that, we require a coupling media to transmit the ultrasound waves to the other material. This happens between the air and the body. Means that most of the ultrasound waves never enter into the body. To prevent this large difference in impedance of coupling media, that is called, we use the coupling media as a gel, which is used in between the air and the skin. You need to match by the similar impedance to ensure the wave passed through the body is known as impedance matching. So, because previously they used only the glasses to transmit the uh, ultrasound waves. That is called impedance matching. But now they use as a gel. This ultrasound gel is made up of an aqueous solution, semi-aqueous solution that is mostly made up of silica, right? Silica-like material. So the main imaging modalities will be the two types of imaging modalities can be used in the ultrasound. One is a grayscale imaging, and the other one is a Doppler imaging. In the case of grayscale imaging, we are using the A mode, B mode, and M mode. In case of Doppler imaging, we are using the continuous wave Doppler, power Doppler, color Doppler, and duplex Doppler, and pulsed wave Doppler. So what is called A scan? A scan is nothing but an amplitude scans. Give no photo images because it is only in one direction. That is called x-axis or y-axis. So pulses of the pulses of the ultrasound sent to the body and reflected the ultrasound is detected and appears as a vertical spikes on the CRO screen. So this is the CRO screen where you can able to identify the peaks in one peak vertical spike so that we can able to identify the uh, distance horizontal, that the distance will be calculated for measurements of fetal film as well as in the ophthalmic scales. So from the height or from the reflected sound is detected by the vertical spikes on the CRO screens, it is made into a fetal head to measure the fetal head and ophthalmic anterior chamber and posterior chamber of the eyes. So coming to the B scan, what do you mean by B scan? What do you mean by B scan? B scan is nothing but brightness scan. So brightness scan means, so when you see the x-axis and y-axis, then you can able to produce the images. When there is only one axis, we cannot produce an image. So we require two axes to produce a live image. Most of the ultrasounds will be live images. So that's why it is called real-time imaging study. So B scan is nothing but brightness scans. An array of transducer are used and the ultrasound beam is spread out across the body. So that is why that ultrasound is detected and appears as a spot of varying brightness. So the returning waves will be detected and appears as a spots of varying brightness. Depends upon the contrast adjustment, we can identify the pictures. These spots are called brightness spots. That is called build up as a pictures. So coming to the next effect is the Doppler effect. Then what do you mean by Doppler effect? The apparent frequency of the wave increases when the source of the waves is moving towards you. So that is why the Doppler effects can be used to measure blood flow in adults, children, and the developing babies. So both the time of for the reflected ultrasound waves and the new frequency of the reflected waves are measured. This enables the speed of blood flow to be calculated. The greater the difference between the original frequency and the reflected frequency, as greater the speed, the computer can display into a moving images by updating the data of several times per second. That's why the blood flow can be identified. Nothing but when the flow is measured, when the flow is measured by a linear probe, the difference between the original frequency and the reflected frequency of the moving particle, that is the blood vessels, the greater the speed, the computer will be imaged as a flow. So coming to this is a Doppler effect. So coming to the Doppler images, there are two types of Doppler images only. One is the red and blue, and the aliasing by the green color. So red is nothing but representing the blood moving towards the transducer. That is the towards the transducers means it will increases the frequency. And the blue is moves away from the transducer. That is produces a decrease the frequency. And another one is the aliasing. Aliasing is nothing but when the two frequencies, two blood flow will be at mixtures. We produce another different type of the frequency that produces an image called green in color. That is called aliasing. So cardiac B scan is the imaging with the Doppler scans. So and the Doppler scans will be overlaid. So this is called A mode. So here only the amplitude mode will be seen, and this is a B mode. B mode is 2D mode. This is A mode is single dimensional mode. This is a two-dimensional mode. And here you can able to find out the images by the reflected reflected materials. So this one is the M mode. What do you mean by M mode? Is nothing but motion mode. Motion mode has during there will be motion of the particles, and then during the motion of the particles it can be vibrated. From the vibration we produce a motion mode. And coming to the Doppler mode, I told about the green color, red and blue. Red is towards the probe and blue is away from the probe. So this is called color flow mapping. That is a CFW. CFW. And another one is a power flow mode. That is called power Doppler. Here we cannot able to find out the which frequencies. It has a higher the frequency that produces a power Doppler. That is called power. And then triphasic, that is called Doppler mode. In the flow, we are doing a pulse wave from the sampling of a particular area, so that the peak systolic will be matched like a mode. So we can able to make a pulse wave Doppler. That is called Doppler mode. Here we have the pulse wave Doppler, color flow Doppler, and then color flow monitoring. So all together is the triplex mode of the Doppler method. So what are the terms? Here we are using the terms. There are three terms to be used. So normally hyperechoic, structures reflects most sound waves and structures appears white on the screens will be hyperechoic. So here in the gallbladder, we can able to find out the hyperechoic structures, that is called calculus. So when the part of the ultrasound waves hits and reflects, all the waves will be reflected and produces a hyperechoic. So then anechoic. So anechoic is nothing but structures allows most sound waves through. Most of the sound waves will be passed through. That is called anechoic emissions. Structures appears black on the screens will be anechoic structures. So it completely penetrates and passes backwards. So and echogenic. So there is a tissue in between that, but the allow some of the sounds pass through and some will be the reflected. So some will be passed through and some will be the reflected. The end result will be the structures appears in various shades of the gray depending on the amount of reflection. So this is the echogenic. So coming to the echogenicity, that is caused by the only purely on reflections. So one is the anechoic, hypoechoic, and hyperechoic. So anechoic is nothing but black, jet black. It penetrates through the transmitting that pulse wave, that long-term wave will pass through that. So it will produce an anechoic. And the hypoechoic. So here, the hypoechoic, part of the echoes, part of the incident ray will pass through the tissue and part will be reflected. So in between that, the reflected will produce a echogenicity, that is called hyperechoic. And the hyperechoic. Then isoechoic. What is that isoechoic? Is nothing but altogether two or the more stretches of the same tissue density, it produces the isoechoic. We cannot differentiate it from the one tissue to the other tissue. That is called isoechoic. Then hyperechoic. What do you mean by hyperechoic? Hyperechoic is nothing but when a complete obstruction reflected, when the ultrasound waves completely reflected, not penetrated, then produce a echogenicity called that hyperechoic. That will be mostly it will be white in color. And then jet black, that is called reflective. So it will be nothing but most of them will produce an after shadow. That is called, it won't produces beyond that. It won't penetrate that beyond that and produce a shadowing that is called reflective shadowing. That is called after shadow. That is mostly seen in the case of gallstone in the tarbell. So coming to that, three echogenicity, mainly anechoic, hypoechoic, isoechoic, and hyperechoic. And part will be reflected. So what are the tissues? So how do you identify the homogeneous tissues and heterogeneous tissues and the isoechoic tissues? So homogeneous is nothing but uniform tissue texture will produce the homogeneous tissues. And heterogeneous is nothing but various degree of echogenicity will be present. Part will be fluid, part will be the solid, part will be the gas or calcifications. This is called heterogeneous. And then isoechoic, the two tissues of the same amount of echogenicity. Here, they both are solid tissue only, but the two tissues of the same echogenicity. If it is isoechoic, isoechoic, hypoechoic, hypoechoic. The two tissue of same echogenicity of isoechoic. So coming to that, next two terms used will be, this is a hyperechoic, heterogeneous. Heterogeneous, here we can see the hypoechoic, heterogeneous, fluid, and the isoechoic. So it is a fluid within the uterus. This is a uterus and this is a bladder. So here you can be able to find out the uterus with heterogeneous protection. So what is the transducers? Higher the frequency, the better the resolution. So normally we are using that, you know about that medical transducers will have 1 to 15 hertz, megahertz. So the higher the frequency we use, better the resolutions. The better the resolution, the better you can distinguish or define the objects from the each other. So what are the instrumentation not normally used in the ultrasound probes? Normally we have the four probes. So what are the probes? Is a curved linear or sectoral probe, and a linear probe, and then cardiac probe. This cardiac probe will be the pediatric cardiac probe as well as the adult cardiac. So here we can use this as a Doppler for sectoral linear probes. In the sectoral probe for the abdominal organs. And then most of the this because sectoral probe will be the 3 to 5 megahertz. It produces the able to visualize the deeper stretches. The cardiac will be the used in the cardiac, that is the echocardiography, and as well as for the other transcranial sonography. And another one is the transvaginal program. Transvaginal is nothing but intracavitary or intrarectal probes. So coming to the straight linear array probe, here the thing is the image produced in this rectangular in shapes because we are using the linear array probe. The probe has a higher frequency of 5 to 15 megahertz, which provides better resolution but less communication. So superficial structures can be very well visualized in the linear probe. So it can be used in the muscles, tendon, subcutaneous patients. So this is the thing. We can able to identify the ribs and then soft tissue as well as the pleural. So this is a linear transducers. So what are the uses of the linear transducers? Will be most of the time will be used as a vascular vessels. That is the central and the peripheral. And evaluate for the deep venous thrombosis. To evaluate the deep venous thrombosis. And then to find out the soft tissue and skin lesions like abscess and flooring. And the musculoskeletal like tendons, muscles, and bones. Here I am telling bones means because part of the periosteal changes can be identified by the linear probe. That too, higher the probes, higher the frequencies, the better the resolution. So higher frequency can be used for the bone identification. That too, only certain things like the periosteal changes or periosteal hematomas. So coming to the collinear array probe. So this is a sectoral probe. This sectoral probe is used for the identification of the diaphragm, liver, and the kidney structures. So this is what are the uses of it is a abdominal aorta, biliary and gallbladder, liver and pancreas, abdomen portion of the fast examinations, kidney and bladder evaluations, and the trans-abdominal pelvic evaluations. So coming to the M mode, what do you mean by M mode is nothing but motion mode. Ultrasound pulses are exhibiting equal sections each time either by the A or B mode images in this treatment. Over a time, the analogs to record a video in the ultrasound as the organ boundaries are that produce a reflection moving organs, that is like a pulsation of the valves in the heart as well as the intraatrial or intraventricular septum move relatively to the probe. This can be used to determine the velocity of the specific organ structures. So this Doppler mode are the three methods. That is a Doppler mode. The mode uses for the Doppler effect is the measuring and visualization of the visualization of the blood flow, that is the color flow Doppler. Velocity information is presented as a color coded overlaying the top of B mode. So continuous Doppler is nothing but Doppler information is sampled along a line through the body and all velocities detected at each time point or presented on a timeline. So what do you mean by pulse wave Doppler? Doppler information is sampled from the only a small sample volume that is called defined as a 2D images and presented on the timeline. So what are the techniques normally used in the abdomen? So we can use the abdomen into four quadrants. That is the upper, right upper, left upper, right lower, and left lower. So this technique is to find out the organ specific. That is, our organ is bladder is full. So we can able to find in the pubic symphysis, if we place a collinear probe, we can able to find out the pelvic structures clearly. So this is a one technique. So coming to the epigastric region. So epigastric region is a cross section. You can see it in the axial section as well as in the sagittal plane. So while seeing that, the same thing can be seen in the right parasagittal and the left parasagittal plane. So here you can able to find out the epigastric region with liver, gallbladder, aorta, IVC, and then portal veins. This is a part of kidneys. So here you can able to identify the epigastric region as a part of pancreas with the portal vein, superior mesenteric artery, and the spleen. So here you can able to find out the aorta. Produce a branch is called superior mesenteric artery. Here next to the right lateral to that is a IVC. So from that we can able to identify the structures. Here we can able to find out the part of liver and then subcutaneous fat. Here we have the peritoneum, subcutaneous that is called omental fat. And above that we can able to find out the subcutaneous plane, that is two planes, that is a deep subcutaneous and the superficial subcutaneous as well as the skin structures. So this is another axial section of the right hypochondrial region to find out the gallbladder pathology. So in order to find out the cholecystitis and cholelithiasis, we have to use the right parasagittal plane. So this is the lateral plane, that is the oblique planes of the both the kidneys, that is the lumbar region. So here you can able to find out the right kidney as well as the left kidney. Here, adjacent to the right kidney, you can able to find out the liver. Liver has access a window to find out the kidneys properly. So next to the same spleen acts as a window to find out the left kidney. Okay. Next, what are the uses of diagnostic sonography? Normally, ultrasounds are best used in the diagnostic imaging, most common in the subcutaneous body structures, including the tendons, muscles, and the joints, vessels, and the internal organs, or possibly pathology like lesions. Obstetric ultrasound is the most commonly used during pregnancies. And obstetric ultrasound is primarily used to find out the dating scan, the viability scan, and from the viability in the location of the fetus, whether it is intrauterine or extrauterine, and then check the locations of the placenta in relation to the cervix. And they check the number of fetus, whether it's a single or multi-para. And then next to the thing is check the major physical abnormalities. What are the major physical abnormalities means? Whether any other anomalies that can be able to find out, whether there is a VSD, ASD, or encephalosis, and then CETV, So we can identify the major physical abnormalities. Apart from that, we have to find out the fetal growth as well as the intrauterine growth interaction and fetal development. And moreover, the fetal movements and the heartbeats. So in case of an emergency department, we can use this as a point of care, but it's for focused assessment with the sonography for fast examinations for assessing significant hemoperitoneal pericardial tamponade after the problem. Ultrasound is routinely used in the emergency department to expedite the care of patients with right upper quadrant abdomen, which may have gallstones and cholecystitis. The vascular assessment of the ultrasound is to assess the patency and the possible obstruction of the arteries. That is called arterial sonography. Diagnose deep venous thrombosis. That is a thrombosonography. And determine the extent and severity of the venous insufficiency. That is called venous sonography. Apart from this, echo can be used in the special probe. That is called echocardiography. Then coming to the head and neck surgery and otoradiology, most of the thyroid and parathyroid salivary glands and lymph nodes can be very well visualized by the high frequency ultrasound. That is a linear probe with the extra anatomical details. This is a preferred imaging modalities for the thyroid tumors lesions. And then in the pre-operative planning and post-operative surveillance of the patient with the thyroid cancers. Then malignant and benign conditions of the head and neck can be evaluated by the ultrasound diagnostic ultrasound, and it can be produced and can be used as a diagnostic guided procedures for euthanasis and ablations. How do you identify the sonographic findings? Normally, intrauterine pregnancy gestation age will be to find out the gestation age, either by the whether it is a intrauterine pregnancy or extrauterine pregnancy, that either by the transabdominal or transvaginal. The first reliable sign will be the York sign, and it will be identified within the 5 to 6 weeks. And then transvaginal scanning, we can able to find out the gestation at more before the 5 weeks, that is a 4.5 to 5 weeks. Normally within the 45 days of conception. So gestation age will be the normal sac, rounded or oval in shape, and central portion in uterus. That is called smooth trauma. So what is called FAST? That is a basic trauma ultrasound. And it is a thing is bedside screening test to find out the direction of the hemoperitoneum and hemopericardium and hemoperitoneum. And not a formal study for detecting the pathologies. Routine, it's not a routine scan. It is only standard views will be the 4 standard view. One is a pelvic, perisplenic, perihepatic, and pericardial. That is called ZD standard view. Mostly we are using the 3.5 sector. Here we can able to find out the fluid around the liver. That is a hematoma changes in the hemopericardium. Here we can able to find out the Morrison pouch fluid. This is a gallbladder. Here we can able to find out the liver on the right kidney. How do you identify the gallbladder? Mostly the evaluation of the right upper quadrant by the abdominal vein for diagnosis of cholecystitis and polylithiasis. Polylithiasis is nothing but GB calculus. And the cholecystitis is the inflammation due to the obstruction of the calculus. So gallbladder scanning technique will be the supine or left lateral decubitus position. Ideally, the patient will be fasting for 4 to 6 hours or fat-free diet. And then 3 to 5 megahertz curvilinear transducers can be used. Start with the transducer in a sagittal plane, the mid-clavicular line and the lower costal margins. So this is the way we have to scan the gallbladder. The pointer should be placed upwards so that you can able to find out the subcostal region to find out the gallbladder. So what is the renal dose? The direction of obstructive uropathy. What is the obstructive uropathy? That is called hydronephrosis in patients with suspected renal colic and then acute renal failure and macerations and infections. Here we have to place the patient in either right or left decubitus respective of the kidney. Curvilinear transducer can be used. Intercostal oblique technique can be used in case of fast scan. We also use a subcostal approach for the in the mid-clavicular line. So coming to the M mode, one dimension of the static B mode can be converted into the M mode. So one mode will be the B scan, another mode will be in the motion mode. This reflection and reflection of the points that will be recorded in the slow time basis, that is produced curves representing movement of the tissue structures. That is called M. So here you can able to find out that one more. Here there is a ECG, and then you have a chest wall, and then a corresponding valve will be depends upon the motion. It curves as a different movements. Depends upon the motion, it produces a curve wave in the corresponding region in the M bone. So this is a pulse wave mode. Here you can be able to find out the peak systolic and end diastolic, and then another peak systolic and end diastolic. So Doppler duplex method is nothing but combination of the B mode, that is a morphology mode, with the blood vessels, that is the more pulse wave Doppler method. So here PW Doppler method will be measurements of the velocity spectrum of the blood flow. Measurements with peak systolic velocity and the end diastolic velocity. From the two measurements, we can change it into the RI index, resistivity index, pulsatility index, acceleration time, acceleration index. So other parameters can be identified by duplex methods. It allows to examine the blood flow inside the heart or deep blood vessels. That is called flow velocity, direction, and characters. So coming to the Doppler imaging, the blue is away and the red is towards. And the turbulence will be the green patterns. Turbulence will be green pattern, blue is away, red is towards. This is a carotid bifurcation, color flow Doppler imaging. And the combination with the duplex method, beam mode imaging with the pulse wave Doppler and the color flow mapping will be the triplex method. This is a triplex method. Here there will be color flow mapping, sampling of this, and along with the Doppler. This is a pulse wave, this is a power Doppler. So this is a pattern of the pulse wave Doppler of carotid. Normally it is a carotid, and this is a internal jugular vein. It is a common carotid organ. So here also we can able to find out the stenosis either by the grayscale, that is called B mode, as well as the color flow. This is a normal artery with the color. This is a calcified clot window. Thank you for listening. Hope you understand about the basic ultrasound images and how what is the basic physics of the ultrasound. Thank you.